felt the frustration of an enlarged prostate impacting your life? What if I told you that the key to reclaiming your comfort lies in understanding simple yet overlooked truths about your treatments? In this video, I'll share with you where most men are missing it when it comes to prostate enlargement treatment and what you can do to correct those mistakes. I will also share with you how to get the manual that I put together for every man who wants to win this battle against prostate problems. Now, if you're a man of African descent, either you are an African American, you live in the Caribbean, or specifically you are from West Africa, research says that you have a higher risk of developing prostate enlargement and prostate cancer compared to men of other ethnicities in the world. Additionally, studies show that men of African descent tend to be diagnosed at more advanced stages and experience poorer outcomes. Understanding this heightened risk is crucial for proactive management. Due to the increased risk, experts often recommend that men of African descent begin screening for prostate enlargement or prostate cancer at an earlier age than men of other demographic groups. So starting regular screenings as early as age 40 to 45 may be advisable for high-risk individuals. I remember a man in his mid-50s that I was discussing with, and he had not done any screening. So I encouraged him to go ahead and do one. He was really reluctant, but eventually he did. And he came back shocked when he was told that he has enlarged prostate. So some people may not have symptoms and their prostate may be enlarged. So the fact that you are not yet having symptoms doesn't mean that you shouldn't check, you shouldn't get screened. It's important, especially for men of African descent. If it's just once a year, you can do it. Have a regular PSA check done. Do your prostate ultrasound scan. It's very important. Moving on, if you are taking finasteride or dutasteride for prostate enlargement treatment, you need to know these two important things. Number one, these drugs lower the production of PSA arising from prostate enlargement and not prostate cancer. So it means that if you do a PSA test while on these medications, you will not get your true PSA value. What you need to do is, if you've been on this drug for about 2 years, there is a value you need to use to multiply it based on the number of years you've been taking it. So if you have been on dutasteride or finasteride and you want to know your true PSA value, if you've been taking the drugs for example 2 years, and your PSA values comes as 3, you need to multiply 3 by 2, which is going to give you 6. That is the true estimate of your PSA. If you've taken it for 5 or 7 years, I shared the number to multiply it by in the manual I'm about to introduce to you. The second important thing for you to know if you're on this medication is the fact that as long as you're on this medication, your PSA levels should be declining slowly over time and should never increase. If it begins to increase while you are taking it, you need to see your urologist immediately, because this is a strong indication that you may have prostate cancer, and a very aggressive one. Now, there's an understudied and often overlooked factor responsible for prostate enlargement, and that is estrogen. Estrogen is commonly associated with female reproductive health, but men produce this hormone in small quantities as well. In men, estrogen is balanced by testosterone, the primary male sex hormone. However, an imbalance can occur between estrogen and testosterone as men age, leading to various health problems, including prostate enlargement. Various studies confirm that the prostate is an estrogen target tissue, and estrogen directly or indirectly affects its growth and development. This can result in urinary symptoms such as frequent urination, weak urine flow, and difficulty emptying the bladder. So to reduce estrogen levels, you need to adopt these strategies. Number one, limit alcohol intake. Heavy chronic alcohol consumption leads to the conversion of your testosterone to estrogen in the liver. It also interferes with the liver's ability to break down estrogen, causing estrogen levels to rise. Another strategy to help reduce estrogen levels and support estrogen metabolism is to consume diets rich in cruciferous vegetables like cabbage, cauliflower, broccoli, and kale. Regular physical activity has been shown to help regulate hormone levels, including estrogen. So aim for at least 30 minutes of moderate exercise most days of the week. Excess body fat can contribute to higher estrogen levels. So maintaining a healthy weight through diet and exercise can help lower your estrogen levels and reduce your risk of prostate enlargement. Also, avoid estrogenic compounds. There are certain environmental toxins and chemicals, such as those found in plastics and pesticides, that mimic estrogen in the body, causing hormonal imbalances. If your treatment for prostate enlargement is not addressing the impact of estrogen on your prostate, it is incomplete. I have put together a life-saving guide filled with practical, reassuring information where I uncover the real reason men get prostate enlargement and prostate cancer and how you can reduce your risk. In this guide, you have a list of super phytonutrients that can help normalize your estrogen levels, lower your PSA, and optimize your prostate health. The two important factors in monitoring your prostate health, your PSA doubling time and your PSA velocity, are also mentioned in this manual. Just click the link below the title of this video in the description box to buy your copy. It's a life-saving guide for all men facing this challenge and the people who love them. Knowing the exact things you need to do to reduce your risk of prostate problems will save you a lot of time and money in the future. Thank you for watching, and I'll see you in the next video.